Hello, everyone. Welcome back to our channel. I'm Dr. Kat Karami, Medical Director of Allurant. Today, I'm going to talk about a very popular treatment, polydactyl oxide, otherwise known as PDO threads. These threads are used for regeneration and lifting. So what is a PDO thread lift? It is, in fact, a regenerative treatment. PDO threads are basically absorbable suture material that was initially created for cardiothoracic surgery in pediatrics and designed to last about 4 to 6 months. And then was found out that it stimulates collagen production and made its way into the aesthetic industry used in the soft tissue. When we use PDO threads under the skin in the soft tissue, it does a number of things. The material sits in place and stimulates your own production of collagen. And the collagen that's produced adds to your own collagen and adds a structure that holds the tissue in that new position. When we lift with the threads, it has tiny barbs that are molded onto the thread. And they act a bit like a tiny fish hook, multiple of them in a row, and they grasp onto the tissue and move it into a new position. So essentially, we're taking the tissue and moving it up without the actual surgery. PDO threads can last up to a year. What makes them last different amounts of time? Well, it's the amount of tissue that we're moving. If we're moving a lot of tissue, then it's going to need a lot of threads. And also the weight of that tissue is going to pull it back down into initial position. What makes it last longer than the 4 months that the thread lasts? That's always a question that patients ask me. So if the threads are going away completely in 4 months, why does the lift last longer? The answer is the collagen is produced along the thread lines. So wherever we have placed the threads, say in the cheeks and multiple vectors, the collagen is produced around the threads. And when the threads go away, that is like a structure matrix that holds the soft tissue in that position for up to a year. The other thing that determines the duration of how long the thread lift lasts is how fast is a person losing their collagen. Younger people are able to have the effect of the PDO thread and have it last longer than possibly longer than a year. On average, it's up to a year. But the younger the person, and the healthier and more robust the production of the collagen is, the longer the effects will last. People ask, why do you use smooth thread? Smooth threads are like using biostimulators such as Sculptra or Radius, but they are staying put in place. So they're not going to move the way the particles of the biostimulators move. A lot of times I add it with another biostimulator to create thickness and robustness in the skin where we get crepiness in the upper arms, in the inside part of the elbows, back of the elbows, above the knees, you can put them in the chest. Another common area that we use smooth threads for is in the tear trough and under the eyes, especially that we don't use fillers in our clinic for that area. So we combine the smooth threads with PRF, and that combination is really good for stimulating collagen and naturally adding some volume to that area. So threads are marvelous. They're really fun to play with as a provider because you see the effect right away for the lifting ones. And then for the smooth ones, it takes about 6 weeks to see the regenerative effect of the collagen. If you're wondering if you're a good candidate for smooth threads or lifting threads, you need to be seen by a provider who's knowledgeable with the anatomy and also with what threads can accomplish, and then find out if that's a good treatment for you.